All right. So, good evening, everyone. And my name is Dr. Paolo Jesus. Usually, I go by the name of Jesus. So I think I'm seeing a new faces, and I'm seeing some Filipinos here with. I'm doing this webinar from Manila, and we here in the Philippines we're in the midst of another typhoon over the weekend. So yeah, so just bear with my signal for a bit because we're off for a very windy weekend. So anyway, let's go with mid-course mastery. So mid-course mastery is something that's very close to me in a sense that understanding patient recalls is something that's very different on how you do your aligner treatments. Now, don't get me wrong. I've been in this road before where we usually just give aligners, ask the patient to come back, check, and then send a new one. Now, most of the problems that we encounter in aligner therapy is aligners not fitting, or let's say, I don't know what to check. I don't know what to look for. All I have to do is just see whether liner is okay, liner is tracking, and then just send in a new one. So in that sense, we need to have a system whenever we're gonna do this because again, we cannot just read and collect payment. We need to perform recalls per course. Now, some might think that this topic is just another thing. But again, guys, I'm gonna show in the succeeding slides that doing recalls will have a bit more clarity and understanding stuff. So one of our, or sort of four of the things that we want to talk about tonight is we want to recognize the essence of recalls during a liner treatment. We also want to understand the cues of what we should do, as well as we want to recognize the need for troubleshooting and recognize when mid-course correction is needed. Now, when you talk about mid-course correction, you have to separate it when you talk about refinements. Okay? Refinements are what we call as additional aligners, whereas when you finish your treatment, you scan your patient again. It's either you remove your attachment or you stay with the same attachment, however it's going to be. But the whole point or the whole idea of refinement is it doesn't meet the desired objective, and you need additional aligners to do that. Now, do not mistake refinement as mid-course correction. Mid-course correction is basically trying to be proactive on ensuring that you manage the amount of refinements you're going to do at the end. So, in other words, the moment you see that there is a problem, you can now start scanning and then recalibrate or reorient, replan your case, or it can follow the same plan, and it's going to make your life a whole lot easier and a little bit more predictable. So it's like doing ortho with aligners, and it's only possible if you're going to control the amount of plastic that you're going to dispense. So let's go deeper into the whole thing. Okay, hold on. Huh? Okay. So common issues are basically is that after you attach your engagers, what's next, right? And most of the time, when doctors or when you guys are actually placing your attachments on aligners, uh, the next issue is what's gonna happen, or when I recall, what am I gonna do next, right? And that's most of the time that's the common issues that you're actually doing. Right. So the next thing is how are you gonna keep track of your patient's progress? And lastly, what are you actually trying to check during recalls? So after you attach your pagers or after you attach your attachments, most of the time, or what I usually do for my patients is I usually give post-operative instructions and reinforcements. And for those who have joined the onboarding last time, we have that list of things that we usually say to our patients, things that we want them not to do, and things that they do. But it's actually broken down into 8 components. Namely, you have your general wear, you have your eating and drinking, things that you want to avoid, when they maintain their oral hygiene, how to take care of their aligners, how to deal with discomfort and adaptation, when to change aligners, emergency issues, and your retention and follow-up procedures. Now, usually, post-operative instructions. Okay, hold on. Yes, hold on. Huh? Okay, all right. So usually, instructions are the key for proper calibration and proper understanding on how your treatment is gonna be. So let's start with general wear, right? Common solutions or liner treatment, pretty standard, 20, 22 hours per day, all these things, it's pretty standard. But you have to look at the rule of the 20 to 22-hour rule. It's not a rule for no reason at all. In fact, there's a 2022 study that looked at it in a sense that orthodontic movement is most effective with uninterrupted force. So in other words, the only time your patient has to remove the aligner is when they're eating and then they're brushing. Always understand that aligners are intermittent forces in nature, and the technique for aligners, despite of it having force decay at some point in time, uh, the appliance wear time, the longer your patient wears it, the more your how do we say that, the more you're simmering the whole mechanics onto your patient as well. Now there is another study that is actually worth a look way back in 2018 that vibrations on patients, that what happened is if patient tends, even wearing it 20 to 22 hours a day, it's not just the number of hours. In fact, it's actually the frequency and duration of wear. Now, even if your patient is wearing it 20, 22 hours a day, but if the patient is removing it time and time again, the effect is not that significant. So the secret is actually, as long as your patient can wear it continuously, you're gonna get most of the result. So the reason why I wanna tell you, or I wanna emphasize this, is because when your patient comes back, these are one of the few questions that you wanna ask your patient. You also want to ask how long on a day, or are you wearing it for 20, 22 hours straight, or do you have moments of significant removal, right? So I have this patient wearing the aligners 20 to 22 hours a day, but this patient is actually removing it for around 10 to 20 minutes because patient loves to eat. So what we have is whenever we have these recalls, I'm getting significant lagging from my patient. So on that sense, as a call on my end, I might want to extend one of my step four for a little bit more time, and then ask the patient to send me another photo, and then so that's the time I'm gonna issue the next aligners, right? So yeah. So if you're wondering whether your patient is having, let's say, significant lagging, ill fitting, you might want to check those small things as well. Okay, because again, you have to understand that around 60 to 70% of the success of your aligner treatment is not on the dentist part. It's actually on the consequences of which, and guys have to take note of this really, really well, that if you have this patients, even if wearing it every day, but removing it time and time again, patient loves to eat, for example, or doesn't really follow, definitely get slow progress. There's gonna be poor tracking because you have interruption versus there's going to be cases come, especially to at the 20 to 22 hour days. And lastly, because of this, you're going to get significant lagging. Ultimately, you're going to get additional costs and refinement. Okay? So, at average, okay? At an average, also, I have a bit of a lag. Okay, hold on. Okay, sorry for that. All right. Okay, so consequences of consequences as well is when you look at additional costs and refinement. There's actually a survey of orthodontic clear aligner practices way back in on 2022, and what they found out that refinements are inevitable even on compliant patients. Now, there is actually a footnote. I just forgot to take a screenshot. Uh, the reason why refinements are inevitable because the doctor already received the full batch of aligners, meaning from step one to the end of the step or for the end of the batch, the doctor already received the aligners already. And he's just checking and checking and checking. And of course, once they submit back for mid-course correction, they're going to get charged. That's why sometimes doctors actually just deliver it. And if it's fitting, they deliver it until they see the end. And that's the time they're going to do refinements. Now, at an average, okay, at an average, they're getting 2 refinements per patient. Okay. And refinements are usually happening on complex cases. Okay. Now, there is another interesting as well. They talked about mid-course correction. Now, mid-course correction is something that changed the game. Usually, mid-course correction is effective for cases where they don't receive the full batch of aligners. Okay? When they don't receive the batch of aligners, just a partial, let's say 5 sets or 10 steps at a time. Because what they can do is they can pivot, they can reposition, they can replan, they can refine some of the plans in the middle so that the following sets can actually from so when you talk about changing aligners on this sense, there is a thing follow 10 days and 7 days. And what I want to do here is let's just give clarity. Okay, so let's do it evidence based. Let's go with the techniques. So one of the few techniques before we go there, one of a few techniques for patients, especially when they're wearing their aligners for the first time, it's going to be a little bit painful. Uh, One of my instructions is just in case that it really hurts, you can actually ask your patient to just get a glass of warm water, dip that aligner for just 3 whole seconds, and then put it back in. Don't do it beyond 5 because you tend to soften the plastic too much. Just 3 seconds, just 3 full seconds should be okay, just to relax the plastic a bit. And for if the patient cannot really bear wearing the aligners at daytime, it really hurts the patient. Perhaps what the patient can do is wear it at night a little bit more. Okay, wear it at night. Don't really remove it. It's gonna help with initial soreness because initial adjustment or initial adaptation of the plastic to the patient's condition is quite a necessity. Okay, all right. So common solutions again. When you go for prescribed schedule, in angle orthodontists by Nadawi and Neil Kravitz and all these researchers here, they actually looked at effect of clear aligner wear protocol on efficacy of tooth movement. And it's very interesting to note that they look at 14-day changes. Okay? 14-day change are statistically significant and more accurate in some posterior movements. However, the difference in accuracy did not really exceed the threshold for clinical significance. Therefore, achieving a clinically similar accuracy between 7-day and 14-day protocol suggests that the 7-day protocol is an accepted treatment protocol. Now, as you can see here, they also included some inclusion-exclusion criteria. Now, 7 days is quite okay if you're only moving a little bit on the anterior, meaning you're moving very, very mild cases, diastema closure, for example. Not much needed for posterior correction if your case is only going to move up to the canines. With first premolar, perhaps a 7-day change is quite okay. Now, what I love about this study is it actually gives a little bit of clarity whether I want to go for 7-day, whether it's okay for me to go 10 days, or whether it's okay for me to go 14 days. Now, here's another study, just a parallel study. Okay, there's a parallel study that they compared 14 days again with 7 days. Now, they actually got the same result where 7 days are quite okay for very, very mild cases. Okay, but if they're looking at posterior movements, they're going to have significant trouble. Meaning there's going to be significant amount of, because a full expression of the plastic forces is not enough for a 7-day wear. Even there's force deterioration or whatnot. Okay. Now, I also have a look at one of the study by from the East, or basically from China, where they look at 10 days and 14-day wear. And what they did here is a beautiful, beautiful, beautiful thing, because they did a randomized controlled trial here. And what they found out in this study, that a 10-day and 14-day aligner group showed similar tooth movement and pain perception. However, look at this. Even if they said that there's no significant compromise in OTM efficiency and patient comfort, it's also interesting to note that one of the recommendations in this case is that the more auxiliaries that you need, the longer time that you should have your patient wearing. So in a 10-day wear, a 7-day wear is quite okay for only up to mild cases. If you already have a moderate case and a moderate to advanced case where auxiliaries are actually needed, 14-day wear is something that you actually need. So in following that prescribed schedule, you have 7 days, 10 days, and 14 days. Settle the score. And just to put it in a most unbiased way, 7 days is virtually faster, but only for mild cases with no posterior movements. Now, 10 days, no significant difference with 14 days. However, it's quite okay for moderate movements, while 14 days turns out to be the most reliable still. And it can handle all kinds of movements. Now, for me who's looking at variation for days and wears, making my treatment much more effective and efficient, not making it fast, easy, and simple, this is something that is worth a look. Now, if you are starting your clear aligner journey, if let's say you're treating your first 5 or first 10 patients, I highly recommend that you go for 14 days. But if let's say you're on your 15th case, you're on your 20th case, you can now just play around with the number of days, because at least you now have experience. Okay, now have an experience of how clear aligners are actually expressing on your practice. So again, as a recommendation, 14 days by default. Even when I'm starting, and I'm up until now, I'm still using that 14 days. But with this new evidences that we just discovered, I highly believe that I may be able to play around the wear duration depending on the complexity and the difficulty of my cases. Okay. So how can I keep track of my patient's progress, right? So I can actually use TrayMinder. TrayMinder is a very wonderful app. It's good for your patients to monitor their progress. However, again, have to understand that it's limited only for patients, and the dentist cannot really monitor it. I mean, it's a tool for your patients. You can check it out. This application is free. TrayMinder, really good. Now, another one that can actually help you and your patient track their progress is with the use of Google Calendar. Now, Google Calendar is really helpful. What? Just create an event, create an event for this one, and then I'm just gonna save the calendar, and it notifies both me and my patient. And you know, it's really good, and it's really effective. One of the revolution of dental informatics in digital dentistry is actually your clinic management. Is it's giving you I mean, it really literally controls your appointment schedule. Uh, me that is actually the thing that I uh, help. Okay, so all right. So there is a thing called the rule of five, and it's really helpful for most applications. All right. Just give me 1 minute. Okay, just give me 1 minute. Let me just fix a few things on my end. Let me just fix my internet connection for a while. Let me just stop presenting for a bit. Hello. Yeah. So, how's my connection at this point? Is it okay? Can we? Do you have a good? Yeah. All right. Yeah. So I just fixed my connection. Just have a little bit of a problem with the connection today. Okay. All right. Here we go. Okay. Okay. Right. Okay. So I really want to reiterate the rule of five. Now, the rule of five is actually very simple. Uh, the concept of the rule of five is it it follows a lot of things, and you're gonna see that when we talked about difference of spaces when you're doing your clear aligner therapy. Okay, doing your clear aligner therapy, uh it actually helps you have a controlled outcome of whatever you're doing. So here's how it works. Rule of five is something like this. Once I receive my first five sets of aligners, I tend to give my patient the first four, and I keep the fifth one. So what's my concept? What's the reason behind it? So you bond your attachment, right? You gave your auxiliaries. You perform the clinical procedures necessary for step one. 14 days has passed, you shift to step two, and then you go to step three, and then you step four. Now, here's the beauty of it. So since we're tracking it in Google Calendar, my associate or my our reception is actually gonna call the patient once the patient have changed into step four. Now, the beauty of this is your patient can now confirm the initial appointment that they just did. Now, one of my struggles when I was starting my clear aligner therapy, if it's one patient, there's no problem. But if you have five patients, for example, or five or more, or let's say three or more, sometimes it's hard to keep track, right? Now, to keep track, of course, you need to have an effective clinic management system that you should be able to maximize to its full potential. So at this point in time, once my patient is on step 4, it's gonna notify my Google Calendar. It's gonna notify our CMS, and that's the time our reception is gonna call the patient to confirm the appointment. So assuming that the patient followed through with all the instruction that we just gave, and she is in fact on step number 4, that's the time we're gonna set the appointment. Now, before I go here, there are cases where I've also experienced where in the calendar, originally, the patient should be in step 4. But once we gave the patient a call, the patient says that she is still on step 3 or in step 2 for various reasons. Now, the beauty of checking on the patient even remotely, okay, the beauty of checking on the patient even on remotely is on the business side or on your practice, you can actually play along, or you can actually guide the patient properly, and at the same time fix your schedules accordingly depending on how the patient is spacing on it. So going into it, assuming that the patient is now within step 4 and you're about to issue step 5 or the 4th or the 5th aligner on the series, I would love to stress on recall and monitoring. So for recall and monitoring, usually you're asking yourself what to do, and you're also asking what to check. Now, this is usually my flow whenever I'm doing recalls. And most of the time, okay, this is the loop that I'm doing until I finish my treatment. So I always start off by inspecting my case. I compare my case, I document it, I evaluate. Now it's either I report or reorder, and then I monitor. Okay? So, what to do? The first thing to do whenever I have my recalls is I always have my treatment sheet and simulations. Okay, so usually here in our clinic we have this screen that we can just play along. I mean, if we're checking on, for example, step 9, we pause the simulation on step 9. And then it's always a good practice to check on compliance and experience. That's why interviews are very important. See if they are wearing 20 to 22 hours a day without delays or without any skips. It's very, very important, right? It's more than, I think for me, it's actually much more important looking at how the small, small things are happening more than whether the patient is changing every 14 days or more than 16 days. Now, I also have this one patient of mine who happens to call the office earlier because the patient is actually on step 4. But when we checked our calendar, patient should still be on step 3. Now, what happened there? When we talked to the patient got really, really excited. Wants to change. The moment the patient doesn't feel that there's pressure, changes to the next step. The moment patient feels its pressure is gone, changes to the next step and the next step. Now, there are patients who are very, very impatient, and you really have to educate that patient on that regard. So, that patient of ours, fortunately, doesn't have a lot of issues in terms of fit, but we told the patient you really have to stick to the wear schedule of 14 days, okay? Because eventually, sooner or later, you might experience a few problems if you keep on doing that. So, meaning, guys, what to do really, you have to make sure that these two things are something that you have. Now, a good practice, however, okay, a good practice, however, is to check the fit of the liners. Okay, so it's not playing. The video's not playing. Let me see. Okay. Anyway, you check the fit of aligners and attachment integrity. So this should be a video. Let me just play for you. Okay. This one, what I'm doing here is we are checking the attachments with the treatment sheets and even with the simulations with the probe or with an explorer to see if it's there. Now, this usually works if I mean, all these things should be ready for you. Okay. Now, third is we usually document progress. Now, it doesn't have to be DSLR. It doesn't have to be with the right setup, but Of course, taking photos is really, really good. It helps you understand your case deeper on a much more controlled environment. And usually for me or for us, we prefer to take two sets of photos. And I'm just going to explain to you why. The first set of photos are intraoral photos without aligners. Okay? So the reason why we're taking it, I'm going to show it to you in a short while. And you just have to take routine photos. Okay, so it's also beneficial for you because we wanna really monitor your patient at this point, and we wanna do things with purpose. Let me just explain. Uh, want to check position versus simulation and progress versus plan. So you want to look at position versus simulation. What you want to do here is to see whether the position of your teeth on the picture tallies very well with the simulation. Now, if a few teeth is not following or it doesn't look like similar to my simulation, well, it's okay. We're going to go to that in a short while. But the thing is, I mean, it should be as close as possible from what is simulated. Again, I'm not saying it should be exact, but what I'm saying, it should be as close as possible. Okay? It helps you evaluate whether you did the nice planning, right? You created the right amount of space. Did it actually follow the right staging patterns that you envision it to be? Basically, what we're trying to look for here are how it fits well with my simulation. Okay, so really, uh, it is an encouraging as well. It's also encouraging for your patient to actually have these things to look at. Okay, okay, all right, okay. Okay. So next thing that you should do is, of course, look at whether you need to perform additional steps. Now, this is where interproximal reduction actually come into play. Now, most of the instruction of interproximal reduction, they don't do it exactly on step one or sorry, exactly at step 10, for example. So like in this case, I'm about to perform a step on before I issue step 10. So meaning patient still on step 9. So I have to perform my IPR first. Okay. So the next step, the next set of photos is you want to perform intraoral photos with aligners. Okay. So why am I taking photos with aligners on? Right? The reason why you want to take photos with aligners on is because even if it looks quite close to the simulation, the gap between your aligners and the current clinical setup will actually tell you a lot of things. Let me explain. There are three ways for us to look at different gaps for an aligner. You have your mismatch, your lag, and your off track. And you also want to look at your auxiliary provisions too. Now, mismatch and lagging is something that's common. Off tracking is something that's not, right? Now, mismatch is very normal because this is a gap between the previous step and the next step. Now, mismatch goes something like this. If you have a default aligner setup and you want to move on to the next step, okay, you want to move on to the next step, your first step is actually the one that's activated, right? So, meaning if you see that there are small gaps around, let's say, around 1.5 to 2 degrees or zero point 0.3 millimeters of gap between your patient's teeth and the aligner that you just issued, it's actually something that's normal because let's say it's gonna move your teeth within the 14-day period, meaning to that position. It's how your aligners are gonna deliver its intermittent forces, and that's where your 20-22 hour rule is gonna apply. Now, lagging on the other hand is a gap that shows that the tooth doesn't really move, okay, based on what your simulation is, but it can still move eventually. Now, let me explain that lagging is a normal phenomenon because it follows Newton's second law of motion, where you need to deliver a greater force to a heavier object. Now, on the very first step, you're gonna have to issue your aligner. Now, there is a common mismatch between your anterior and your posterior teeth, and most of the time, it's around 0.2 to 0.3. Now, the force of 0.2 to 0.3 can somewhat pass on that movement threshold that can influence your incisors to move. However, sometimes a 0.2 to 0.3 millimeters is not enough to move your molars, meaning it's too weak. So, what are we going to do here? Now, you don't have to worry about it because the worst case scenario, if the force is not enough, the tooth is not going to move. However, if the force is too strong, that's the one that's dangerous. That's why even for aligner treatment is still ortho. You still want to move low and slow, right? Now, because again, at the end of the day, once you move on to step two, the mismatch is going to increase. And that mismatch can actually be sufficient to actually influence your molar to move in a sense that it's actually delayed one step. So in that sense, you have a lagging scenario. Your anteriors are moving on track. However, you have a lagging that is your molars are lagging one step behind. So this is an example of a superimposition of a patient scan wearing, I believe, step 9, and we compare it. Patient has finished wearing step 9, and we compared it on the actual step 9 of the aligner model. And as you can see here, let me just switch to my. Okay, I don't have a pointer here, but let me just show you that on the anterior segment, what you're seeing here is actually lines are actually superimposing very, very well. Now, when you look at the posterior, there is a little bit of gap, a little bit of splitting of the lines, and that splitting of the lines, if it's within 1.5 millimeters, it's still considered lagging, right? Now, if it's more than 1.5 millimeters, this is where the problem comes in. You have an off tracking, right? You have an off tracking. Now, off tracking is even if you move and move with your aligners, that tooth is not going to move or that area is not going to move. Okay. And usually doctors, it happens quite often for cases where you have advanced movements or cases that doesn't have necessary space. Now, the beauty of off tracking, it's not entirely a mystery to start with. In fact, off tracking can be traced back to some of the issues that you're going to experience on the first 5 principles of aligner treatment. Let me just show you a quick example here. Now, here is if you're planning to rotate, for example, a premolar and without any engagers, what happens most of the time is that the aligner slips. And once the aligner slips, you're going to have an off tracking setup. Now, because of that off tracking setup that you just had there, okay, uh, what you violated here is the first principle of aligner treatment that aligners are actually pushing. Okay, that the aligners are actually pushing. Now, if you missed out on that pushing scenario, there's not enough grip for your premolars to actually rotate. Because again, at the end of the day, your aligners doesn't know that this is 3-5. What your aligners know that this is a rounded object, and it just goes on and on and on because the surface that it's actually in contact with is actually slippery. Now, here's a good example that this case have reached, I think, the second or third refinement, meaning additional aligners. Patient have already finished wearing the aligners and now we're programming extrusions. Okay, we are programming extrusion. Let me just go back here and just show you the video once more. And as you can see here, 2-1 is actually pushing down. Okay, even if you place a good amount of engagers for this patient, you know what? Patient wear 5 sets of aligners, and this is what we are left with. Okay, this is already a form of off tracking. You see a significant amount of gap, a significant amount of lag, right? Why? Because now we are looking at okay, we're now looking at a clear unfollowing of principle number 5 of overcorrections and programming. So, following that sense, doctors, sometimes when you look at refinement, okay, when you're looking at additional aligners, sometimes you have to look outside the box. This is one of those cases where we recognize that after 2 rounds of refinements, we wasted 10 aligners, but we get the same result. We are not gonna do it on the third time. We have to do something. Now, if we want to extrude, definitely push is something that's not going to work. Now, extrusion, okay, we use the same aligners. We did not go for another round of refinement. We used the last aligner, but this time around, we went for troubleshooting. Now, one of the key things that you want to consider when you do recalls is always make sure that you have at least a button and elastic at the ready, because you want to make sure that this thing tracks properly. If teeth doesn't teeth doesn't follow the plan, sometimes you just have to override it a bit. You don't have to go straight to refinement. Sometimes troubleshooting cases until it goes on track really helps, and then it can proceed as usual. And that's the beauty of doing recalls. You can actually perform overrides. You can actually perform troubleshooting. It doesn't really necessitate another round of another round of refinement or another round of mid-course correction. Sometimes you can just override the situation, knowing that extrusion is much more effective with the pulling motion. Might as well just use button and elastics and then just pull it down. Now, if you're asking what have we used here, uh, we bonded the button straight on the tooth. We cut on the plastic. All right, we cut on the plastic. We bond a button on the tooth, and then we bond another thing on the aligner. Now, what we used on the button on the aligner is a material we call cyanoacrylate. Well, cyanoacrylate in layman's term is just super glue. Okay, just be sure to just keep it dry. Again, guys, it's plastic. Super glue works as long as you keep it dry. In fact, guys, if you're going to look at ADA list of materials, of dental materials, do you know that cyanoacrylate is actually a dental material? You can have a look. If you're doubting that it's not a dental material, it actually is, and you can use it for these purposes as well. Okay, so what we did here is they patient placed an elastic, tried to pull it down after a few months. I mean, elastic is changed. I believe the elastic what we use here is a 316 elastic, and after a month of doing it, changing it every day, it finally went on track. Now, definitely the patient's happy at this point. It can go for debonding and can go for retention. Now, if it's actually in the middle that happened to you, you can now just basically issue the next step of aligners now because it's now back on track, right? If you know what I mean. I mean, in other words, when you talk about recalls, it actually invites you to see which cases that you can troubleshoot. Again, understand that clear aligners, of course, it's still ortho. Understand that even if we plan the things with the right physics, tissue reaction actually varies from patient to patient. And troubleshooting is something that we also have to figure out, right? Now, here's another case where we want to perform rotation of 3-5, okay, just to simplify the whole thing. Now, the difference of this one from the earlier case, this one is we recognize that 3-5 is not gonna rotate by simply placing an attachment and using an aligner. We need to do something because we recognize that the rotation of this premolar, okay, so meaning in this case, we learned a little bit better. So this premolar is more than 30-degree rotation, meaning more than 30-degree rotation, it's considered moderate to advanced movement already. So in that sense, we need to use an auxiliary. So on the simulation, what happened here is basically uh, placing a button initially, and we're just going to issue the first 10 steps. And after the first 10 steps, we're going to have a look at the case. Let me just play the video once more. We're just going to have another relook at the case. It's going to rotate for 10 steps. And once 10 steps is done, we're going to take another rescan and then proceed the plan as usual. So initially, there's 45 steps on the lower. Our goal is to decrease the total number of steps by performing the rotation with auxiliaries, meaning we're going to override the whole thing. We're going to go faster than the aligners have predicted by using buttons and elastic. And this is one classic example of which where on the 10th step, the 3-5 is already rotated. So meaning the 3-5 or the rest of the teeth is still following the plan, but 3-5 went ahead and we made the case a little bit milder for this case. Okay, so what we did next is we take a rescan. Now it's ready for a replan, meaning what we're expecting here is a significant decrease in the number of steps. Now, the concept behind troubleshooting, recalls, understanding lagging, mismatches, and off-tracking is actually rooted to this wonderful study on aligner predictability. Turns out, as you can see here, extrusion and intrusion, purely vertical movements are actually not so predictable. Okay, not so predictable when you're doing aligner treatments. Now, you also have to look at the first 4 movements, namely distalization, expansion, tipping, and rotation. They're actually space creation movements, which are very essential to be put on the very first stage of your aligner treatment. Staging is not placed there for no reason at all. In fact, staging is actually coming from predictability thresholds, whereas you really want to create space first because space creation for clear aligners is one of the first predictable movements. Meaning if you're going to start off with space creation first, you're not really expecting mid-course correction on that stage because you're actually creating space. The only time you're going to do mid-course correction on the space creation stage is when the space that you created is insufficient and it needs a little bit of overcorrection to proceed to the next stage. Okay? So, if we're just gonna touch through, off-tracking can actually be rooted on the 5 basic principles of clear aligner therapy. You're gonna get off-tracking for clear aligners if the design of your mechanic should be push, but your intention is pull. Let's say your staging is a little bit flawed, of course, you're going to have issues with that. If you don't consider your anchorage, you're going to get off tracking, not because of poor movements, but poor anchorage consideration. If you're not intentional on how you create your space, definitely you're going to get an off tracking because your teeth is just not going to move if there's no space as a prerequisite. And lastly, of course, if you don't have programming and overcorrections incorporated on your cases, definitely you might be geared on having a lot of mid-course correction or maybe a lot of refinements in the future. So in other words, trying to stick or trying to go back to your fundamentals will really, really help you understand how things are going on with your aligner treatments per se. Now, to close it out, I want to summarize on that sense on how mid-course correction actually differs with refinement. Okay? Now, mid-course correction is performed during the initial series of aligners or sometimes during in between, whereas refinement usually occur after the initial series is finished. In other words, if you have 30 steps of aligners and you finish the whole thing, and you need additional aligners, that is already called refinement. But mid-course correction is the power of those who are ordering and dispensing a few aligners, let's say 5 to 10 aligners at a time. Okay? So in terms of purpose, mid-course correction is much more proactive in a sense that you want to address teeth that are not tracking to get the treatment back on schedule. So when you talk about mid-course correction, it doesn't necessarily mean scanning and replanning alone. Mid-course correction is something that can help you give an override scenario where you use buttons, elastics, sometimes wires and brackets to make sure that your aligner case goes back on track. Now, refinement, on the other hand, is to make minor adjustment. Meaning, when you talk about refinement, it doesn't mean that you're going to change the entire treatment plan. When you talk about additional aligners, it means that you're still following same plan. You just need a little bit of overcorrection. You just need a little bit of refinements, as they say, to do it. Right? Now, if your conception of refinement is because aligners are not working and all those things, you're getting the wrong idea. Okay? It may be rooted to poor planning in the first place. Okay? On your end, maybe space is not created intentionally. That's why you're getting refinements. Maybe overcorrection is not yet programmed. That's why you're getting refinements. Okay? So when it comes to efficiency, mid-course correction gives higher efficiency because it proactively allows for course correction and reduces the need for extensive corrections later. Meaning, once you actually go for an actual refinement, you're only looking at 3 to 5 aligner, additional aligners. Okay, in my experience back then, when I'm used to receiving all the sets of aligners, when I have additional aligner stages, I always get the comprehensive package back then. But when I have additional aligners, most of the time for moderate and advanced cases, usually it's the same number of aligners, which is kind of frustrating. But with the power of mid-course correction, I tend to be proactive about it, meaning I'm actually fixing the bearing, the route, and the speed, the efficiency of my treatment with the same destination in mind. And that's the beauty of an MCC. Okay? In cost implications, definitely, it may require a new set of aligners from the point of correction onward. But the beauty of it is if the aligners are not yet produced, okay, if the aligners are not yet manufactured, the cost is something that's already covered, right? I mean, basically, you're literally doing new an update for free, technically, right? You're creating the next batch of aligners with an update. So I highly believe that having done those things, especially for moderate and advanced cases, is how we should do ortho in the first place, or how we should do aligners in the first place. Whereas for refinements, it also involves producing new aligners, which definitely will incur additional costs depending on the regional treatment contact. And the evidence studies, from the studies that I've shown you earlier from the first part of this lecture, uh, it identifies risk factors for needing mid-course correction. One actually finding that 50% of extraction patients required mid-course correction because in our technique or in the way we perform extraction cases, it requires a lot of auxiliary. So in other words, it may be not just extraction cases. If I were to put it on a more universal positioning, any case that has auxiliaries, it may necessitate mid-course correction. 50% it may necessitate mid-course correction. It's very, very rare that for a moderate or advanced case, you don't need mid-course correction. Always understand that if you have a moderate or advanced case, anticipate mid-course correction. Okay, you always have to anticipate it. It may happen every 10 steps. It may happen every once you're 50% done. Just anticipate that you need one. Always prepare your hearts for mid-course correction, especially that. For mild cases, you might not need MCCs, but you might need a little bit of refinement because a significant percentage of cases require refinements. The study that I mentioned earlier found that 6% of patients finish treatment without refinements and 22.4 actually needing one. So, what does it tell us, doctors? There's actually a way, although evidences haven't been supporting it yet, we can actually reduce the amount of refinements that we're going to do if we are proactive, if we are self-aware that MCC occurs. Okay? What we want to do is we need to have proper mid-course correction protocols. So, Uh, we're gonna have another round of Sebaris onboarding. We're gonna have a 2 day session. Actually, it's much more intensive. If you wanna learn this and a few more tips, tricks on how we use aligners, or the five principles, how they interact, how they roll. Uh, you know what? Aligner treatment is way different on how it was introduced, and I'm more than happy to share to you for 2 days in with Samaris. It's gonna happen in November. If you're interested to join, you can message Sebaris-ED, or you can reach out to our customer support team here, to our market to Sebaris's marketing team, and I would love to see you exchange ideas, share the journey on how we can deliver clear aligners on a much more friendlier and open source way. And lastly, of course, I am going to Malaysia anyway in November, and I really want to see you. I really hope to see you as well in Dentistry Unplugged. It's actually one of the biggest event in in dentistry in the ASEAN region. I think to date, ever since I'm a dentist, I have never seen such an assembly of wonderful people here. Yeah, so if you want to join Dentistry Unplugged, you can message Dentistry Unplugged ASEAN or Asia to join. Yeah, so I hope to see you on those events, and hope you enjoyed our webinar tonight. Okay, apologies short for some short brief interruptions on the internet connection. So we're now gonna field a few questions. I think you can type. Yeah, you can type your questions for me for this. Okay, so here's one question. Hi, doctor. If during the treatment, if you want to check whether it is on the right track, can we compare the vertical movement as well, or only the occlusal view? Definitely, you can look at the vertical movements, doctor. In fact, you can take side photos and frontal photos. If I'm gonna, maybe I can share one case here. Let me just pull it up for you. I'm gonna share my screen here with you. Okay, hold on. I've actually just recently have a good upload here. Okay, here we go. Okay, let me just have a look. Okay, okay, here we go. Let me just open up. Let me just share my screen. It's a good question actually. So this is one case that I have. And let me just immerse you real quick on how I see it. So now I have this patient here, and I actually placed bite ramp. Okay. So if I'm looking at vertical changes, I'm actually looking at some resolution of the deep bite that I just have here. Right. I'm looking at some resolution on the deep bite. So patient is currently on step 9. Okay, so I did a checkup on step 9, and I'm about to issue step 10 for this patient. So if we're gonna roll on this, I have 9 steps going on this aligner. We're moving everything here. Okay, and then here I'm doing distalization on the upper. As you can see, I've placed auxiliaries. I have buttons here for my auxiliaries. Yes, okay. So I'm doing it here. And I have my occlusal here. Let me just show you my occlusal as well. I have my bite ramps here to manage the deep bite. I'm performing distalization as well. Okay, and on the lower, look at this one. I'm utilizing the side effect of the distalization with the button to actually utilize it to visualize my molar here. So what am I expecting is when I'm distalizing it, I'm actually controlling my vertical with my elastic and then I'm doing it. So what I'm expecting here to see some vertical changes. Now, if I'm going to look at the progress of this patient, here is the patient on step 9. As you can see, I'm getting significant gains. You can see that there is some molar asymmetry on my pre-operative photo, but as you can see here on the progress, my molars are finally symmetrical with the right distalization protocol, right? So there's something that I'm checking when I'm doing this distalization. It's on step 9. Now, vertically, okay, here on the lower, you can see that it's actually going according to plan. It's not surprising, but it's something that I'm actually watching out for. This one is actually has moderate predictability. Molar visualization, it's quite challenging, but with the right vertical control, I think it's quite nice. I mean, to see that everything is now starting to become symmetrical at this point. Yeah. Okay. Now, here's the vertical change that you're looking for. This one, you see that there is now resolution of the deep bite similar to what I see on my what do we call this? On my simulation. Bite ramps are just incorporated in the aligner. As you can see here, you don't see any bite ramps bonded here, but this is what I'm actually trying to see on the vertical dimension. So meaning I can look at even on the frontal photos, if you have the side photos, that's going to be so much better. And yeah, and that is actually fun. Yeah. So I'm going to mark this as answered. Thank you for that question. That's really, really nice. Any more questions on that? Just stop sharing. Okay. All right. Do we have more? Okay. All right. So maybe I'm just gonna have another question here. Doctor, what if I don't have and what if I have an off tracking and let's say I have 5 aligners on number 4, I'm seeing that I'm about to be off track. Now I still have number 5 on my hand, but uh how am I gonna go about it? Yeah. So if you have a refinement issue, meaning you're about to do a mid-course correction, but you're still on step 4, step 9, basically, you still have one aligner left. Now, the beauty of the rule of 5 is that even if you have signs of off tracking and you're planning to do a rescan and a replan, you can still issue the last aligner. At the end of the day, it's just gonna deliver zero point 0.3 millimeters of movement, or basically around zero point 0.2 net force. If you scan that, the next batch of aligners doesn't really is not really gonna. I mean, it's not. It's still gonna fit, right? It's still gonna fit. Okay, so yeah, the problem is if you ignore signs of off tracking early on, the next batch of aligners may not be able to fit. So my recommendation is to be vigilant. Look at those things. Have to be very careful, right? Look at those small nuggets of gaps. Evaluate whether it's for off tracking or not, or it's just a simple lagging. And then just be proactive about it. I think that's the only solution. Yeah. So if you don't have any questions, doctors, I think we're okay. I think that's all the questions that we have for tonight. I thank you for joining, and I hope you guys are safe. And yeah, hope to see you guys in November. Thank you very much, guys. Good evening and good night.